loves. This May, it is all about activities at CCA. And so we're talking about exercise, enrichment, fulfillment, and meeting our dogs' needs. And that can be really hard with super sensitive dogs, dogs who have behavior challenges, and dogs who have maybe physical disabilities. And sensitive dogs with behavior challenges and physical disabilities or chronic pain is my specialty. And I've got a really amazing guest joining us today. So let's see if we can have her up and then I'll introduce her.
Hi.
Beth, hello, yay!
Hi, how are you?
I'm doing well, love. I'm glad it worked because Instagram has been super glitchy about joint lives. And thank you so much for joining. I was thinking about content for this month. And one of the biggest challenges that my community tell me about for their dogs is that they have these dogs who have big feelings, they have big needs, but they have really fragile bodies and often have injuries or disabilities or chronic pain. And Beth actually is my veterinary physiotherapist who works with me and Hera on some of his chronic pain. And I just couldn't help but ask her to come and join because I was like, Beth will be able to give us some guidance about this challenge. So maybe Beth, you could just introduce yourself to start off with so people can get to know you and what you do, etc. And then we can dive into the juicy topic.
Yeah, sure. So I'm Beth. I'm a canine physiotherapist and hydrotherapist here at Squirrels Chase Vet Physio that I started about 4 or 5 years ago now. Since I have worked with a lot of dogs with behavioural issues, behavioural needs that obviously need to be accommodated, which to be honest, I absolutely love. I love dealing with the dogs that have some sort of behavioural issue or accommodations because I'm basically a one-man sort of clinic. I can prioritise my time, so therefore I can accommodate these dogs, which I absolutely love. So yeah,
you really struck me as like a rehab. Like you're just not just an expert in veterinary physiotherapy. It's like veterinary physio for these super sensitive dogs. And when I have my clients ask me questions about this, one of the first things they say is, "Well, how the hell are we going to do physiotherapy, massage, laser, hydrotherapy? How are we going to physically rehab and strengthen my dog who hates people and equipment and touch?" And Hera is exactly that dog. And you were fantastic. Honestly, like you really knew what you were doing. And literally you were over here the other day doing a little session with us and he was asleep on the floor while you were massaging him. And honestly, guys, I think starting us off is if you're working with your dog who struggles with pain, you find a practitioner like Beth. It will really do you so much good. I have to thank Lauren for that, actually, my work wife. She found you.
Yes,
I was so scared and nervous at the beginning because it's so hard to trust someone with that. So I was thinking today, like, for me and Hera, one of the biggest challenges has been he's a poodle. You've seen him. He is mad for the frisbee. He wants to run around. He wants to throw himself around, but he has hip dysplasia, cruciate ligament injury, stenosis, and an arthritis. And I have to make a huge amount of adjustments to him, to his day and his activities to stop him from flaring. And I'm sure that's something that you see with your clients all the time because there is like a few musculoskeletal challenges that just plague our communities, and that's what you kind of specialize in. I see you every day and it's like hip dysplasia, cruciate injury, lumbar stenosis, like it's the same problems, arthritis over and over again.
Yes, it is. It is just kind of about managing the dog. I mean, every dog's completely different. Some manage in different ways than other dogs, and you also got to appreciate they're dogs, so there's only so much you can limit while also allowing them to have a decent quality of life. But honestly, the main thing is always manage pain. Manage pain is always number one priority, and then we can kind of go from there after. And for me, it's obviously what the dog will allow me to do. Some dogs that come in here I can't touch. Absolutely fine. I'll find a way to do something that I need to do a different way. Or there's some dogs come in here that just you need to take your time with them, and eventually they will let you do most things, to be honest. And half of these dogs are coming in with long-term conditions that I probably will be treating for the rest of their life. Absolutely fine. So then I take it slowly and I make sure they're comfortable in my session. Which definitely makes a big difference.
One thing that really stuck out to me there is like when we're dealing with these painful dogs, I think a lot what the story that happens in my community is that people join my programs, my membership, we look at their dog's behavior, we go, hey, there's something going on with this dog's body. And often they go, oh, we have to go and diagnose it and treat it, and then it won't be a problem anymore and we can move on. And often I'm saying to folks, hey, with these super sensitive dogs that we work with and specialize in, and that you work with and specialize in, these chronic health challenges are likely often a longer term thing. So I think lots of people are like, I just want to solve the problem and fix it. And often I say, you've identified the problem, and now we will be building relationships with people like you, Beth, and always prioritizing the long-term care of that dog. And I remember the first few sessions that we did with Hera, you know, we had to take lots of breaks. We had to go outside and run around, and we didn't get everything done that we wanted to do. And you were very easy on me and going like, no, it's fine. Like if he says no, we don't have to. And I think that's just such a key piece of the puzzle for so many of these dogs, is finding someone who's not going to force them. And this is a big problem. I see like sometimes people send me their videos of them dogs doing physio, and the dogs are very uncomfortable and people are physically moving them into different positions and they can't handle it. And I have to go like, wait a second. Okay, we need to prioritize the mind as well as you can't just move their limbs for them if they're shaking and tensed up. Like they need to be participating to some degree. And you were fantastic with him. Managing the pain for him, for every dog it's different, right? There are like so many different ways that we can do that. For Hero, we did things like physio, massage, pain medications, huge part of that, like different exercises, and then managing also his activity and movement. You mentioned like you have to let them be a dog, but we also can't let them injure themselves. And I think lots of my clients don't know how to toe that line. So some of the things that I'm literally saying to them, and I'm sure you can maybe help me here, is like, every floor needs to be really grippy if we're going to be walking or playing or running, like literally things like that people just don't know, that you have to put really good rugs or yoga mats down if you're going to play with your dog or train doing sits and downs. There has to be grip on the floor. You have to cut the hair off their toes if they got grinchy feet. And people send me videos and their dogs are like playing frisbee on slippery floors and like smacking into walls, and they're like, I wonder why they're sore. And I'm like, what? I don't know, what sort of advice do you give folks about like managing movement without ruining the joy? Because that's the big challenge, I think.
So at home, I always say, like you said, the non-slip surfaces. Obviously, a lot of people don't want to cover their whole house with furniture or rugs, but you can pick up very cheap little off-cut rugs to put around the house that they walk on regularly. That limits something. Then you've also can do ramps. So something like getting in the car, in and out of the car. If the dog likes to go in the car, they're getting in the car and out the car regularly, jumping in and out from probably laying down for the past 2 hours or whatever. Some simple, a ramp. It can collapse in the car. You can put it up, put it down as needed. That always helps. And also same with the bed.
Yeah. Wait, what about the bed? Like a
ramp going up.
A ramp to get up into the bed so they're not jumping. Listen, this is actually like so key. And I think that lots of people skip these steps. They go like, oh, they can jump on the couch, it's fine. That was me. I was like, oh, he's fine, he'll be all right. And then I'd watch him like jump into the car and trip and like face plant onto the floor. Or like you're saying, he's been asleep for like 3 hours. And then he gets up and chases a ball across the slippery wooden floor, and I just watch his leg kind of twist underneath him, or he jumps in midair to catch a tree, does a full 180, you know, and then lands on the floor. And I'm often saying to my clients, I'm like, your dogs have maximum tenacity and zero resilience or physical and minimal physical ability, and that is a poor combination. And so often I'm like, with Hera, for example, I had to change things. Like when we're getting in the car, I had to like really prepare and hold his harness, because if I open the door, he's so excited. He's like, ah, like get me in there. So I'm like having to really change things like waiting, holding the harness, helping lift him in this way. And I think people don't think that those small accommodations are going to make such a big difference to the dog. But with the specific dogs in our group, and Beth, I know you get a lot of dogs like this, it's like the Aussies, the Shepherds, the Poodles, the Doodles, the Terriers, and these dogs think they are an Olympic athlete. They really do. And then the reality is so different.
Yeah, unfortunately it's not that.
I have
a lot of these dogs that do have chronic conditions, they have lower proprioceptive control than other dogs. So this, a normal dog might be able to jump on their sofa absolutely fine, but unfortunately something with maybe a bit of osteoarthritis in a joint somewhere has lower proprioception. So they're more likely to crash into the sofa or the wall.
Oh my gosh. And then my clients always say to me, like, they're so clumsy, like they're always doing all, they're like, you know, they aren't thinking. I say this literally. We went to the park the other day with here is my best friend who's a massive coonhound mix.
Okay.
And I let them go too early on in the walk, and they were just so excited that, you know, Hera ended up body slamming the big dog. The big dog rolls on the ground, then jumps on Hera. Hera falls on his head. Yeah. And I'm just like, whoa, 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 whoa. And I have to put everyone on lead for a minute. And then guess what? He's limping 20 minutes later. And I'm like, why did you do that to yourself? And in my head, I think a lot of people go, what's wrong with you? Like, why would you do that when you hurt yourself? But I have to remember that's part of the condition. It's that they have less ability to, and I, hands up, I have hypermobility spectrum stuff, so I have EDS, but that basically means that I'm the same as these dogs. I think that I'm really muscly and strong, and then I go for like a 2-mile hike and I'm like limping at the end of it. And so I understand how it feels to have bigger eyes than your stomach, essentially, when it comes to movement. And a lot of the time I'm saying to them, you have to keep them on a lead. And that's like really upsetting to a lot of my clients, because these reactive and sensitive dogs, they want them to have the big joy. And I'm like, I want them to have the big joy too, but if they're going to be limping for days afterwards, we have to find a midpoint. And I think there is a midpoint, right, which is treat the pain. We don't want to stop them from moving at all, because that's another really big problem. Like, not moving is not the answer. We need to make sure that we're treating the pain with physiotherapy, with manual treatments like you provide, like laser and, was it ultrasound, the one with the gel? Oh, here, I hated the gel. He got really good with it though. He got good with the gel. A massage. And then when you do those and meds as well, that unlocks movement that they can do safely. And that's what I'm doing with Hera. I basically do all the exercises you give us, and then he takes his pain medications before big hikes. And then I have to keep him on a lead, because if he has pain medication, he feels $1 million. And he's like, I'm going to jump over every log. And I'm like, no. So people get surprised, I think, though, that that's such a big part of the answer is this management of their movement. And I think really helpful in the house, we have non-slip floors, we have ramps, so that jumping from rest. I always say to my clients, be careful when you're playing with them, because I always love to throw really intense frisbees for my poodle, and then he's like skidding, bumping into things, hurting himself. So thinking about play. Any other accommodations that you can think off the top of your head that just are good to think about, just in general? Warming up on lead was one you were really good with me about. You were always like, did you warm up on lead? Which is like 10 minutes on a leash before you let them off leash, if they're going to be off lead, to run around.
Very simple, but it makes sense. You wouldn't go on a 5K run now without warming up or cooling down. No. It's just 10 to 15 minutes on a lead before and after some sort of medium to high intensity work can reduce the risk of injuries. That's really important. I think another one that's quite good is raising your food and water bowls. Rather than being on the floor and them having to shift all their weight at the front end and kind of shift their neck down, if you raise it up, much more leveled body, much happier. And then I think if they're getting they're really starting to struggle with movement, something like a supportive harness or sling always works quite nicely. That really helps. But if you do need to help them up, at least then they've got something to hold on to, it fits correctly, and you can support them around the house, so they're not limited just to one room.
That's huge. Yeah, like that's definitely. You also don't necessarily want hands on their body all the time. If they need help being moved, it can be helpful to be able to pick up the equipment to help them. And I think hearing this, when people kind of come to work with me with their sensitive dogs, I think they are a little overwhelmed by how many pieces of the puzzle that there are, I think. And I think when I then say to folks, okay, we need to do this investigation and education into pain and movement, I think they can just go, whoa, that's a bit much. But I think what I wanted to highlight by bringing you on is people like you exist, and we have to find practitioners like Beth, because for our community, that health piece, that physical confidence, that gaining the ability to better control their movements and have a better proprioception is a big part of the healing process. And so you'll want someone like Beth on your team who can help you. And you might not find the perfect practitioner the first time. You might be working with multiple. And Beth, you also offer some virtual services, don't you? So if anyone's not local in England, you can always access professionals like Beth. We've featured a few other people like this on our page before who can provide virtual services. Can you tell folks a little bit more about that for me?
So normally how it works for me is they either come through virtually with a diagnosis, or they've done some sort of online gait analysis with me, which basically just allows me to assess the dog without being present. Now, it's not ideal. It's not going to be ideal because I'm not there in person being able to assess the dog. But in cases where you can't find anyone that's helping you, or you're in a location where stuff like this isn't possible, it's your best chance, and it's better than doing nothing. So via that, I can sort of suggest, especially with dealing with chronic pain, I can suggest possible medications, areas that need to be investigated further, and then kind of from there we can create a treatment plan. So depending on what I find will depend on what you guys can do at home. I can give you some exercises that you can do, and also just be there to support. I think that's overlooked so much. It's very difficult looking after a dog that's highly sensitive or got a lot of medical issues going on. But actually, if you manage it well and have someone, either your vet or a physio or someone on your side to help you, makes 100 times difference.
I really can't double down on that enough. And it's hard for people to, when I say like, you need to expand your care team, that's a hard ask for some folks. Resources can be tight, and I am the same. Like, I have to navigate, you know, where I'm going to be putting my resources. And what we teach at CCA is like this HEAL framework, and it shows like 4 different areas that affect behavior. So we have health as the first one, and I always say to folks, health is at the beginning because it's at the foundation. And so if you are figuring out where should I put my resources, time, money, you start there, because if we make them feel better in their body, everything else about their behavior is improves and feels, and we see it kind of trickling down that way into everything. And I see that with Hira so much, that I spent a long time trying to work on his behavior, and I had neglected this piece of the puzzle, thinking, oh, this is just, you know, he's just a painful dog. That's what he's just like this. He's a grumpy dog. He's a stubborn dog. There's nothing I can do about it. And working with you really showed me like, no, there's so much we can do. Like there's one day I was complaining to my girlfriend about it on the phone. It was like one of the first das that we got a full laser session on him, a really good one. And the next day he was so perfect on leash. And I was like, for fuck's sake. I spent years trying to teach this dog to walk next to me, and actually he was uncomfortable pacing at my pace. And the minute he felt more comfortable, it was easy for him to move with me. He knew what I wanted, but his body made it uncomfortable and punishing for him to literally do it. And I was just like, for fuck's sake, Beth, damn it.
Sorry.
No, it's great. I needed to see it because it unlocked that for all of my clients and my community, that I can say to them, you know, similarly to Hira, your dogs also probably need to see someone like Beth who can teach you these things. And I think hopefully today, like, my big takeaways here are like, there are immediate things that we can do if we have painful dogs, like changes to their environment, the home environment, the way we're walking with them, the way that we're encouraging movement and facilitating movement. But to really get those like transformational results, I really do believe you need to work with someone kind of like yourself, and what you provide is the multimodal help. Because often my clients will go to the vet, and the vet will give them maybe like an NSAID or something like that, and I'm like, okay, that's a start, excellent, but that is not it. Like, we don't just go, okay, ibuprofen for life. No, we figure out how we can strengthen that leg, what else can we do to help the arthritis not have it develop too much, etc. And that's where you come in, Beth, and you're kind of like the body version of me, I feel like, where you take this zoomed out approach and kind of fill in the gaps for everyone and pull together a plan that works across different disciplines. And I'm just very grateful for you offering us some time for free today, because honestly, guys, Beth she knows her shit. So check out, can you just tell everyone where they can find you?
So website is www.scvetphysio.co.uk, and it's Squirrels Chase Veterinary Physiotherapy.
Amazing. And so if any of you guys are interested in learning more about pain and behavior, you guys can read the caption when I post this, and I'll talk a little bit more about some free resources there. I will post also Beth's handle so you can go and see her and check out her practice, because I don't recommend practitioners often because I'm, you know, snooty bitch. And I really think Beth's fantastic. And if anyone out there is struggling, just know you can find someone like her to help you. And is there anything you want to add at the end, Beth? Any final thoughts for us as we finish up today?
I think trust your dog, trust your instinct, and trust your dog.
Yeah.
I get a lot of people who go to the vets, don't necessarily get the outcome they want. Mm-hmm. Trust your instinct, trust your dog, find a good vet and a team around you, and don't accept no as an answer.
Oh, that is just such an excellent point.
Answer. And if you do scans and it shows mild, that doesn't mean there's nothing wrong, and it doesn't mean pain.
I can just double down on that enough, because we're talking today about we've been talking about the treatment part when we know kind of what's going on. The getting the diagnosis part of the piece of the puzzle is actually often one of the most challenging parts, and that's what I'm going to talk about a little bit in the caption when I post this, because we have a little webinar about exactly this. It's called Hidden Hurt, and it's all about how it can be challenging to get pain taken seriously. So for example, we can see that, you know, we have dogs that are limping and people are saying, oh, they're fine. Or they're probably not painful. I had a dog with IVD the other day, intervertebral disc disease, one of the most painful spinal conditions. And they were like, I shouldn't be painful. I was like, it literally is a pain condition. I just don't understand. I'm so confused. So people don't believe pain sometimes, or they look at a scan and say it's mild, when actually the dog is saying, this really fucking hurts. And they're going, well, it shouldn't. And you can imagine who we think we should be listening to in those scenarios. So I'll send a little bit more info about that in the caption. And I just want to say a big thank you, Beth. And I hope, I know you're going to go back now to seeing probably about 20 dogs today, because you're just absolutely the busiest.
Well, thank you for having me. Really
thank you so much, love. All right, I'll post this so everyone can watch it, and everyone go and check out Beth's page.
Thanks,
love. Bye.